Have you ever wondered what to do when you lose a tooth? Losing a tooth is a more common occurrence than you might think. It's not just about those childhood memories of the tooth fairy or an unfortunate accident. Tooth loss can occur due to a variety of reasons, from gum disease and tooth decay to lifestyle habits like smoking. And when it happens, it leaves you with a decision to make. There are 4 primary options to consider when you find yourself with an unexpected gap in your smile. You could do nothing and leave the gap as it is. You could opt for a bridge to fill in the space. You could choose a dental implant for a more permanent solution, or you might consider a partial denture. Each option has its own set of pros and cons, which we'll explore in detail. So let's delve into these options, shall we? First up, the do-nothing approach. Sounds easy, doesn't it? Well, it's exactly what it sounds like. You lose a tooth, and you do absolutely nothing about it. You simply carry on with your life, minus 1 tooth. On the surface, this approach might seem like the simplest, most hassle-free option. After all, there's no need to book dental appointments, no need to undergo any procedures, and certainly no need to worry about the cost of dental work. But is it really that simple? Let's delve a little deeper. When you lose a tooth and don't replace it, it can lead to a domino effect of dental issues. One of the most apparent problems is the shifting of other teeth. You see, our teeth support each other, and when one goes missing, the others may start to drift into the empty space. This can lead to misaligned teeth and an uneven bite, which can cause discomfort and difficulty in chewing. Moreover, the do-nothing approach can also affect your jawbone. Without a tooth to stimulate it, the jawbone in that area can start to deteriorate, causing a change in your facial structure over time. This can make you appear older than you are. And who wants that? And let's not forget about the social and psychological impact. A missing tooth, especially if it's in a noticeable spot, can affect your confidence and self-esteem. You might find yourself smiling less or avoiding social situations altogether. Now, don't get me wrong. I'm not saying that the do-nothing approach is all doom and gloom. For some people, especially those who've lost a back tooth that's not visible when they smile or speak, this approach might work just fine, but it's important to remember that every person is unique and what works for one might not work for another. Before you decide to do nothing about your lost tooth, consider the potential consequences and discuss your options with a dental professional. While it may seem the easiest route, the do-nothing approach may not be the best choice for everyone. Next, we have the option of getting a dental bridge. Now, a dental bridge isn't a structure that helps you cross a river of enamel, but it does bridge a gap left by a missing tooth. It's essentially a false tooth called a pontic, held in place by the abutment teeth on either side of the gap. These abutment teeth can be your natural teeth, or they can be dental implants. So, what's the upside of going with a dental bridge? First, a bridge can help maintain the shape of your face, which can be affected by tooth loss. No one wants a droopy cheek, right? Secondly, a bridge can prevent your remaining teeth from shifting. It's like a holding pattern for your pearly whites. You see, when a tooth is missing, the neighboring teeth tend to drift into the empty space, which can lead to a bad bite or even gum disease. But just like a real bridge, a dental bridge also has its tolls. The most significant downside is the potential damage to the adjacent teeth. The abutment teeth must be prepared, which involves removing a portion of their enamel to accommodate the bridge. This can weaken the teeth and make them more prone to decay. If not maintained properly, the bridge can also cause problems for the underlying gums and potentially lead to infection. Another drawback is that, unlike an implant, a bridge doesn't stimulate the underlying jawbone. Over time, this can lead to bone loss, which can change the shape of your face. Lastly, while bridges generally cost less upfront than implants, they typically need to be replaced every 5 to 15 years. So, in the long run, they may end up costing more. A bridge can be a great solution, but it's not without its downsides. As with any dental procedure, it's essential to weigh the pros and cons, and most importantly, consult with your dentist to determine the best option for you. After all, every smile is unique, and so should be its care. Now let's talk about a more permanent solution, dental implants. Imagine having a tooth that feels, looks, and functions almost exactly like a natural one. That's the magic of dental implants. They are metal posts or frames that are surgically positioned into the jawbone beneath your gums. Once in place, replacement teeth mounted onto them behave much like your own. Dental implants have several advantages. First and foremost, they offer durability. With proper care, dental implants can last a lifetime. This makes them a cost-effective choice in the long run. They also provide a stable support for artificial teeth because they fuse to your jawbone. You won't have to worry about them slipping or shifting in your mouth, a problem commonly associated with dentures or bridges. Furthermore, implants maintain the natural shape of your face and smile. They prevent bone loss in the jaw, a common occurrence when you lose teeth. This is because the jawbone needs the stimulation it gets when your teeth connect to maintain its form and density. Now, let's get into the downsides. The most obvious one is that getting an implant requires surgery. And with any surgery, there is a risk of complications. These can include infection, nerve damage, and sinus problems. However, these risks are generally low and can be further minimized by a competent, experienced dental surgeon. Another potential con is the cost. Initial costs for dental implants are higher than other tooth replacement options. However, because they can last a lifetime, they can be more cost-effective in the long run. And last but not least, the process of getting implants takes time, often several months. This is because the implant must fuse with the bone, a process called osseointegration, before the replacement tooth can be added. Dental implants offer a long-term solution, but they come with their own set of considerations. So it's always best to discuss these factors with your dentist to make sure you're making the right choice for your oral health. Lastly, we have the option of a partial denture. Let's take a moment to dive into this solution. A partial denture is a removable appliance that replaces missing teeth. It's designed to fit snugly over your gums and jawbone, filling in where teeth are missing and giving you back your full, vibrant smile. Now, one of the biggest draws of the partial denture is its affordability. When it comes to tooth replacement options, a partial denture typically comes with the smallest price tag. This can make it an appealing choice for those on a budget or without dental insurance. Another advantage is that it's a non-surgical option. Unlike dental implants, getting a partial denture doesn't involve any procedures that cut into the gum or bone. For those who are apprehensive about undergoing surgery or have medical conditions that make surgery risky, this can be a significant benefit. However, as with any option, there are also some potential drawbacks to consider. One of these is the potential for discomfort. Although partial dentures are custom-made to fit your mouth, they can still feel a bit awkward or uncomfortable at first. This can be especially true while eating or speaking, and it may take some time to adjust. Maintenance is another consideration. Partial dentures require daily cleaning to remove food particles and plaque, and they need to be removed at night to give your gums and jaw a chance to rest. Moreover, because your mouth naturally changes shape over time, you may need to have your denture adjusted or even replaced every few years to ensure a proper fit. In conclusion, partial dentures are a viable option for tooth replacement, offering affordability and a non-surgical approach. However, they may not be the most comfortable or convenient choice for everyone, particularly those who prefer a more permanent solution or dislike the idea of daily maintenance. Partial dentures offer a non-surgical option, but they may not be the most comfortable choice for everyone. So, we've looked at 4 options you have when you lose a tooth. Let's wrap it all up, shall we? First off, we discussed the do-nothing approach. It's the simplest, and it's certainly the most cost-effective, at least in the short term. But leaving a gap in your teeth can lead to complications down the line, like shifting teeth or bone loss, which can be more expensive to treat. Then there's the bridge option. Dental bridges can fill the gap and look like natural teeth, but they require the adjacent teeth to be filed down, which can weaken them. The bridge's lifespan is also something to consider, as they often need replacement after 10 to 15 years. Next up were dental implants, the more permanent solution. They stand alone, not requiring support from surrounding teeth, and they can last a lifetime with proper care. But they come with a higher upfront cost, and the procedure can be more invasive. Lastly, we talked about partial dentures. They are less invasive than implants and are less expensive. They can be a good solution for multiple missing teeth. However, they aren't as stable as implants or bridges, and they require more maintenance. All these options have their pros and cons, and the best choice, well, it varies for everyone. It depends on your oral health, your budget, your lifestyle, and of course your personal preference. This is why it's so important to have a discussion with a dental professional. They can examine your mouth, understand your needs, and guide you towards the best solution for you. They can answer your questions, address your concerns, and help you make an informed decision. So don't rush into a decision. Take your time, weigh your options, and consult with a professional, because your smile is worth it. Remember, the best solution is the one that fits your needs and your lifestyle. It's always best to consult with a professional to make this important decision.